Bloomberg World Headquarters in New York, to our audience worldwide. I'm David Westin. Welcome to Balance of Power, where the world of politics meets the world of business. On the brief today, Kevin Cirilli from the White House on President Trump's promise of a fiscal stimulus plan today. From London, Bloomberg anchor Guy Johnson on Italy on lockdown, and Abigail Doolittle right here with me in New York on the rebound that we are seeing finally in stocks today. So, Kevin, let's start with you. The president sort of promised he's going to have a plan this afternoon. I guess it may have taken some of his own people by surprise. Are we going to get it?
Yes, we are. Later this afternoon, President Trump anticipated to unveil an economic stimulus of sorts that his administration says will be able to help to combat some of the negative effects, not just of the coronavirus, but also of the oil sector. I can tell you that in speaking with a prominent member of the energy political lobbying world within the past 24 hours, there is palpable frustration even amongst the president's supporters and donors who have really been a part of the energy sector, who are now incredibly anxious over the fallout of the past 24 to 48 hours. Turning the page, however, and playing it forward, lawmakers up on Capitol Hill now openly discussing the potential to have some type of regulations lifted and also some type of tax relief effort in order to help consumers as they continue to deal with the negative effects of the markets and, of course, the coronavirus.
I suppose the one thing we know is going to be in it is some sort of payroll tax deferral or relief or something like that, because he said he was going to do that. Does he have support from the Democrats as well as the Republicans for whatever he needs to do up on the Hill?
He won't have the support of all of the Democrats, but he likely will have enough support to get whatever he needs over the finish line. I flash back to last week when there was an $8.3 billion worth of coronavirus funding that advanced out of there in a nonpartisan way. There does seem to be an understanding from lawmakers that something has to be done. Okay,
Kevin, thank you so much for reporting from the White House. It's Kevin Cirilli, our chief Washington correspondent. And now we turn to London and European clothes anchor Guy Johnson for his report on Italy. Actually, Guy, I understand the entire country's on lockdown. What does that even mean?
I think the Italians are trying to figure that one out as they go along, to be honest. But the extension from what was a quarantine in the north to the entire country now is in force. And if you break the rules, there is potential jail time at risk here. David, let me update you what's going to happen over the next couple of hours. At noon Eastern time, we are going to see a video conference taking place between the EU leaders. The Elysee Palace, within the last few minutes, has been updating us on what we can expect out of that, and the French are certainly indicating that they feel that there needs to be more than a monetary response to this crisis, that there needs to be some kind of a fiscal response as well. That is looking less likely out of Germany, but the Elysee Palace, the French government basically making it very clear that needs to happen. It's going to be interesting that Christine Lagarde, David, is going to be on that video call. So maybe what we are going to see is a meshing of monetary policy and fiscal policy coming out of Europe, and we may get some news from that very, very shortly. We're also watching what is happening when it comes to the travel sector here in Europe. David, today we've seen British Airways and Ryanair, the biggest low-cost carrier here in Europe, the biggest carrier here in Europe, cutting all flights to Italy. Spain, the Spanish government has also cut all flights to and from Italy as well. So another factor that is going to quarantine that country. We've also seen some relief. It looks like we are going to get some relief for EU airlines. The slot rule, which is a kind of use it or lose it rule, David. If you don't use the slot out of somewhere like Charles de Gaulle Airport, you will lose it. That is going to be suspended temporarily. So we are, David, starting to get some relief for the transport sector here in Europe. David.
Okay, thank you so very much to Guy Johnson, our anchor colleague over in London. And now it's time to get a check on the markets right here in New York. And joining us now is, of course, Abigail Doolittle. So what goes down must have come up a little bit sooner or later.
Yeah, well, you would hope that that's true. And we are seeing that at least a little bit today, a little bit of a rebound rally. But of concern, David, at this point, we're well off the highs. At the highs, the Dow had been up 4%. Now it's up about 1%. The S&P 500, a similar gain, now up about 1.5%. Oil had been up at least 9%, now up 6%. Bonds not pulling back quite as much. So all of the uncertainty out there around the coronavirus and what the impact could be on the bottom line continues to weigh, because even if the Trump administration introduces a stimulus, which would be very important for Americans. For investors, we still don't know the spread of this virus, unfortunately, in this country, or what the fallout will be, again, on the bottom line for companies. You can't value the unknown. So that's what investors are grappling with.
And that is my question. I mean, here on Balance of Power, we tend to think it's all about the government, which it's not. We know that's not quite true. How much of this do we think really is because they're anticipating that plan that's coming out of the White House? And actually, is it possible they might get disappointed if it's not as much as they might hope for?
I think it's very hard to answer that question because, again, I think it goes back to what is the actual impact of the virus in this country. Right now, I believe we have a little more than 500 cases. If it stays there, the impact on the country is probably likely to be very little over the next month and a half. On the other hand, if it surges once tests get out on the street or get out into the country, it could be a very different picture. I mean, take, for example, companies like Darden and Cheesecake Factory. Those stocks are getting decimated, but the virus hasn't really even impacted their results yet. But traders are selling them as though Americans aren't going out at all. To the degree that that does happen in the future, it seems as though traders are, to some degree, pricing in the worst case scenario. Technically, it looks like the worst case scenario could actually get worse. So no matter what the stimulus is, until we know what we're dealing with, it's hard to re-stimulate.
Okay, you'll have to come back to explain that to us. Thanks so much to Abigail Doolittle for that report on the markets. Investors have been whipsawed this week, and it's only Tuesday. We're only 2 days into the week, with record losses yesterday, followed by a sharp turn up today. We welcome now George See. He's chairman and co-founder of Annandale Capital. George, great to have you here in New York with us.
Thank you, David.
So you particularly focus on oil and gas and investing in oil and gas and natural resources. Boy, on top of everything else that's going on, oil has really taken a hit this week.
And it's not going to bounce back very quickly. It's taken so much technical damage as well as substantive damage that this is going to be a process that plays out over a very extended period of time. I think even if the Saudis and the Russians got sensible all of a sudden, that the oil still wouldn't bounce back very much because people are skeptical at the ability to keep the spigots from being full throttle at some point again in the future.
And how much of that's because we had some shale producers, some independent producers who were out over their skis a little bit? They'd borrowed a lot of money, they had some high yield debt and things like that, and this might shake that out.
I think that's going to shake out dramatically. I think that Wall Street is done financing these companies, and some of them are going to barely scrape by and survive, and some of them are going to be left for dead, or they're going to merge with much larger companies. Investors should really be taking a hard look at the survivors: Royal Dutch Shell, BP, Chevron, these gigantic companies that are going to exit on the other side stronger than they were before and are going to buy up assets on the cheap. And I would focus on that and not some of the penny stocks and smaller shale producers that will be lucky to make it.
What about U.S. Energy policy at this point? Because President Trump has repeatedly said he likes to have low, particularly gas prices. At some point, does it start to really put at risk our U.S. energy business?
When oil was super high in the 70s and New York nearly went bankrupt, I think that impacted the president and his view on the oil and gas markets. And I think he still thinks that commodity prices that are low and gasoline prices that are low are best for the country. That's not exactly the case anymore. The shale industry has gotten so big, it's such a powerful part of our economy that we're really better off with oil in the $60 to $80 range and gas in the $250 to $350 range, and we're well below that. So we jeopardize hundreds of thousands of jobs, hundreds of billions of dollars of capital, and the president needs to be informed to the contrary because he's still stuck in the 70s.
Part of what triggered this was actually the Crown Prince, Mohammed bin Salman, really saying, okay, fine, Russia, we'll just start pumping and really cut the price a lot. President Trump has had something of a close relationship with the Saudi regime. Is it possible that President Trump might go to them and say, look, enough's enough, we can't have it be that low?
I heard he called him last night. Now, what came of that, who knows? I would also say that the de facto ruler of Saudi Arabia is 34 years old and incredibly inexperienced and has shown a tendency for wild swings in behavior. And let's face it, this is a friend of convenience. This is a country that chopped up a journalist in little pieces in somebody else's country. They're not to be completely trusted. They're not to be counted on to make positive, wise decisions. And we're going to have to be real careful with how we interact with them over the next year.
So you're an investor and an advisor to investor. Given what's going on, both with respect to the oil crisis, I think we can call it a crisis at this point, but more broadly with what's going on with the economy and what we're seeing in the markets, what are you advising investors? What are they asking of you?
That's an interesting question. We've had very little panic among our investor base, and most people are excited that we're slowly buying in. And we've told them if markets get much more extreme than this, we're going to get much more aggressive in our buying, and they all really like that a lot. I would come back to the Middle East very briefly again, because we need to watch for stability in the Middle East, because with oil in the low 30s, Iran is in jeopardy. Some of the other countries are in jeopardy, including Saudi. If you look at the royal family and how tightly they've had control on the Arab street in that country of 30 million people, if they bust their budget and they stop handing out money to their patrons, things could get unsteady over there.
Well, and to your point, George, even at the same time we were seeing this really price war break out, we also had reports that there were some other princes that were being arrested who might be a threat to Mohammed bin Salman in case of a succession, in case the king were to die. I mean, are those two potentially linked up?
I think they are. I think that they've been swinging wildly in Yemen. They've been swinging wildly in terms of their policy to Qatar. It just looks very disjointed. It actually looks like a Middle Eastern facsimile of the Trump administration, which I agree with most of the time, but there's wild swings in policy.
And that's spoken by somebody who's not necessarily opposed to the Trump administration.
I'm not. I'm for it, but it can swing around.
It can swing around, that's for sure. Okay, many thanks to George C. He's Annandale Capital Chairman. And coming up, we're going to get to talk to a congresswoman from Michigan, Debbie Dingell. They have a primary there, but also she's involved in figuring out what our response should be to the coronavirus. That's going to be coming up next, live from New York. This is Balance of Power. This is Balance of Power. I'm David Westin. Representative Debbie Dingell, a Democrat, has urged bipartisan action to combat the coronavirus from the very beginning. And this afternoon, we're promised a plan by the president. Congresswoman Dingell comes to us now from Capitol Hill. So thank you so much for being with us, Congresswoman. Give us a sense of what you would support, what you're hoping to see out of the White House in terms of a plan to respond to coronavirus.
You know, first of all, we got to work together. We've got to get more test kits out there. It's just been a real problem. So how do we support the president? How do we make sure that money's available for that? But now, David, we're moving into how do we make sure if somebody's sick that they stay home? And a lot of people can't afford to stay home, or they're afraid to tell somebody that they're sick because of what the consequences are, or they can't afford the test. We've got to take care of that. We've got to make sure that people who have to stay home for 2 weeks are going to be taken care of. We've got to worry about food supply and food shortages. We have to worry about price gouging and how do we keep the economy going. All of those are really important. And I think a lot of Republican members who might sometimes have issues or, you know, they're just policy differences. Daycare is another that, you know, if a child shouldn't be at school, how does somebody provide for daycare? I think everybody knows we have a public health crisis. There are some differences. Maybe we could be working a little harder, a little faster, but we got to work together. There's no way that we're going to protect the public health of all of our constituents if we don't.
So, Congressman, give me just 1 minute on that sick pay issue, because that's something that's on a lot of people's mind. A lot of these people are hourly employees, and they don't normally have sick pay from fairly small businesses, restaurants and things like that. Is it feasible for Congress to get something up and running to get money into the pockets of those people if, in fact, they have to stay home with their kids or, for that matter, for themselves?
Well, we're having those discussions this week. I think people would love to try to even get something through this week, but if not this week, in the next couple of weeks, it's really important. You know, David, there's some really basic issues that people don't think about. I said this yesterday in the leadership meeting. We're telling people to wash their hands. There are people across this country who can't afford to pay their water bill, and they don't have water, and they're afraid to tell anybody that they don't have water because they're afraid the child custody is going to show up and take their children away. There are just a lot of things that you and I are lucky enough to not think about that are real across this country in communities that impact all of us.
Exactly. We don't think about the disproportionate effect on those who are less fortunate among us. Let's turn now back to your home state, my home state for that matter, of Michigan. There's a little election going on there, a primary today. What are you expecting to have happen today? Because there's this real fight now between Bernie Sanders and Joe Biden.
First of all, I don't believe any of the polls. 4 years ago, I could just feel on the ground that Bernie was going to win, and the polls had Hillary 25 points up. So the fact that Vice President Biden's leading right now, but having been on the ground, I think the senator will for sure win. Senator Sanders will win my district, but I think it's Joe Biden's to lose this time. A lot of people that didn't care or didn't like or didn't think their vote mattered this time really are worried about the direction of the country. They don't like the fear and the hatred that they see. and they're engaging in voting, and I think a lot of them are voting. The African American community seems to be coming out for Joe Biden.
At the same time, we have not only what you call the hatred that is shown in some parts of the country, but also we now have some uncertainty over health and ultimately the economy. We're seeing in the markets every day. Is that starting to permeate the electorate in Southeast Michigan?
Well, I think health care is very complicated. You know, I'm neutral on this primary. There are two people that I respect. Joe Biden was one of John Dingell's closest friends. I worked with him. We all worked on the auto industry. But Medicare for All, my father-in-law wrote Social Security and was the first person to ever introduce Medicare for All. I don't think people understand it. Union workers are worried about losing the benefits that they've worked very hard to get for over the years, and things that they've heard make them think that they might not. But what we really need to is we're just talking about everybody needs to not be afraid to go and get tested if they're sick because they can't afford to pay for it, because that has public health consequences. So you are hearing that discussion a little over the weekend, pre-existing condition, being in the courts fighting it, high prescription drug prices. You're hearing all of that I hear it every day, but the candidates have heard it over the weekend.
Michigan, of course, went very narrowly for President Trump 4 years ago. What would be different this time around, do you think?
Well, first of all, I think it's still a competitive state. I don't think anybody who thinks that Democrats have now sewn up Michigan should get any sense of feeling it's okay. I think Democrats have to do a far better job of talking about issues that matter to working men and women, not only in Michigan, but across this country. There are a lot of people that just want to, and now what's happening to the economy because of the coronavirus is one of the things you have to look at. They want to have a job. They want to be able to put food on the table, educate their kids. If they're sick, afford to go to the doctor, afford their medicine, and have a safe and secure retirement. Trade deals matter to them because they think nobody's cared and their jobs have been shipped overseas. That's a pretty basic agenda that Democrats sometimes forget and we have to talk about. And President Trump did understand that uncertainty that was in their hearts. He understood trade deals that had shipped their jobs overseas. And, you know, there's a steel plant closing, or it's on layoffs right now. Many people expect it to close. And those steel workers are telling me those environmental regulations are putting us out of our jobs. So it's complicated.
Yeah, at the same time, you also have GM investing in Hamtramck. So, I mean, it looks like there's some jobs that are going to be coming back. Congratulations on that, because I know that's something you've worked on very hard. Many thanks now to Congresswoman Debbie Dingell, joining us now from Capitol Hill. Okay, in the meantime, we are, of course, watching the markets as they seem to bounce back today. And we're going to have a special report coming up just in a few seconds now. This is called our daily Wall Street Week report, and we're joined now by our Bloomberg contributor. He is Larry Summers. Of course, he's former Treasury Secretary, among many other things. He's joining us from Cambridge, Massachusetts. So, Larry, thank you very much for being here. We are going to get, we're told, a plan from the president for fiscal stimulus this afternoon. And one of the things he specifically says is it's going to have a payroll tax cut or deferral. Does that make sense?
I think if it's designed right, it probably does make sense, particularly if a significant part of the stimulus is going to employers who choose to retain their workers, who choose to offer sick pay for their workers who get caught up in medical problems associated with coronavirus. But I don't think anybody can think that tax cuts of the kind we've gone to the well with in past recessions are sufficient at a moment like this. There are complex financial issues with maintaining the flow of credit on which the Treasury and the Fed need to partner. There's urgent need for developing adequate infrastructure and facilities for testing and treating and, where necessary, quarantining people with respect to these problems. We are not an island in the world. And unless we cooperate with other countries, what no one country does is going to be sufficient to contain this problem. So I'm glad to see the president recognizing the role of fiscal policy. But as I've been saying now, I think we need a plan that is coherent, that is coordinated, and that is comprehensive. And we don't need a set of ad hoc measures with people going around congratulating themselves for having come up with a measure or a proposal. We need to be thinking about what we want to be doing today to put ourselves to be in the right place a month or 3 months from now. So yes, the impulse to fiscal policy is probably appropriate. I don't think the levels that people are talking about in the low hundreds of billions of dollars are likely actually to be sufficient in the context of more than a $20 trillion economy. I think we've got to recognize that the risks are very much on the side of underdoing it.
So exactly, and that goes to the question of how big is the breadbasket here. I remember back in 2009, there were a lot of questions being raised about whether, in fact, we stepped up big enough in the fiscal stimulus, and many economists thought we did not do it big enough. Do you have any sense of the sort of magnitude that would be required sufficient to accomplish what you're talking about?
I think we'd better have an apparatus in place that will enable us to be spending at a rate of above $500 billion a year by the end of the summer. I'm not certain that all of that will be necessary, but we've got to have the capacity to be spending at more than that rate. And it wouldn't surprise me greatly if we had to escalate beyond that. I think the odds are 80% that we will have a recession, and we need to have contingency planning for a likely recession, and we need to do that planning with the awareness that a serious inflation problem really looks very unlikely from here.
So one of the people you used to work with actually used to say that you don't want to let a good crisis go to waste. Is there a possible upside to all this? You've been very concerned about secular stagnation. And we talked actually with Philip Hildebrand, he's vice chair of BlackRock, earlier today, and he invoked your name saying maybe we could have enough fiscal stimulus here to get past that secular stagnation. This is what he said.
This may also be an opportunity where we look back, you and I, hopefully 5 years from now, we could say, you know, that was the moment that kind of got us out of this secular stagnation trap, for lack of a better term, to get what Larry Summers calls escape velocity. Whether that will happen, who knows? But I think that's where the market is going to really focus on government action in the months to come.
Larry, is that hoping for too much? This could actually give us escape velocity?
I hope so. It will take our being willing to act more decisively and more ahead of the curve than we have traditionally as the economy goes towards downturn. That's about fiscal policy. That's about public investment in infrastructure. That's about the Federal Reserve's actions in spurring the flow of credit. Frankly, the announcement yesterday about the Fed kind of hopes that banks will lend more struck me as being pretty empty and not very well specified. So I think there's the prospect that we will use this as a moment to push forward on the economy, but we can't just assume it'll happen.
So Larry, you've talked in the past about the fact that it's not so much the price of credit, but it is the availability of credit. We're seeing some real pressure in the credit markets now because of the oil price war that's going on. There are some economists now who are saying it's not so much the interest rates from the Fed that we need. We don't need cuts in interest rates. We need infusion of dollars, whether it's through repos, whether it's through FX exchanges, FX swaps, things like that. Is that right? Do we need an infusion of dollars? Is that part of the solution here?
There's a global dimension in terms of avoiding a dollar scarcity. There's a liquidity for financial institutions dimension that's essential. There may be the kind of issue that Europe has been meeting for some time with providing funds to banks on very favorable terms so that they can on-lend it to companies that are facing difficulties in credit markets. It's all availability from here. Nobody's basing their investment decision on whether their interest rate is 50 basis points or 20 basis points. And so I think a focus on the best means of making credit available is very much the right thing for the Fed to focus on. And that will involve cooperation between the Treasury and the Fed, because there'll be degrees of risk, tranches of risk that might be appropriate for the Fed to take on. But the main risks, if there's going to be taking on risk, that's an appropriate role for the Treasury and for elected Democratic, small d, Democratic officials to make. There's some risk that some of the things we did after the financial crisis that would make the emergency provision of credit more difficult may complicate things. But I think that just as there were break the glass plans during the 2008 period, there needs to be contingency planning for major credit issues. We shouldn't take a day like today when markets rebounded as any kind of lull or ground for complacency.
Should we be putting on the table some relaxation of some of the regulations that went into effect with respect to the banks that did make the banks unquestionably safer, but maybe we should look back and take a look at sort of some of the reserve requirements and things? Is it time to look at that?
I'm not sure we should change them on a structural basis. What I do think is the reason banks have capital and the reason banks accumulate reserves is so that when there's an emergency, they can spend down and keep flowing credit. And now we have an emergency. And so it may be a time for strategic forbearance. That's what, if I were in government right now, I would be convening the financial authorities at the Treasury, but from the financial regulatory agencies to look at what made sense. We certainly don't want to sacrifice the gains we've made on financial stability in the last few years. But on the other hand, the only reason to have capital is to use it in an emergency. And this is increasingly feeling like a pretty serious emergency.
And is this a time when you get together with the big banks and basically talk this through? I mean, you've been in the room in a different circumstance. Is that what should be going on?
I think we're certainly at a stage where we should be hearing what their ideas are, getting their assessment of credit market conditions. But gosh, I think there needs to be complete clarity of a kind that, frankly, there hasn't been in some of the president's rhetoric, that the big banks are a means to an end. The objective here is not to have there be liquidity for big banks or to protect the shareholders of big banks. The objective is to maintain the flow of credit, to maintain the level of employment, and to maintain the flow of funds in the economy. And that's the objective. And then the question is, how can big banks be a means to that end? But it's very important, and I sometimes think the Secretary of the Treasury isn't entirely with this point, that it be recognized that the big banks are a means to an end, not the ultimate test or the ultimate objective of our economic policies. The ultimate objective is the well-being of middle-class Americans.
Okay, Larry, thank you so very much for joining us again today. That's former U.S. Treasury Secretary Larry Summers. He was with us for today's Wall Street Week update on Bloomberg Television and on Bloomberg Radio. And now let's get more on the coronavirus with Dr. Beth Cameron. She served as President Obama's Senior Director for Global Health Security and Biodefense on the National Security Council. That is, by the way, a position that President Trump eliminated. And now she is Vice President for Global Biological Policy and Programs at the Nuclear Threat Initiative. And she comes to us today from Washington. So welcome, Doctor. Good to have you with us. I mean, part of the reason you're here, frankly, is you're an authority, but also you came out with a report last fall that said we're not ready for a pandemic. It looks like you were prescient.
So, yes, and thanks so much for having me. We released last fall a Global Health Security Index, which looked at 195 countries for their pandemic preparedness for exactly threats like the coronavirus that we're facing today. What we found is that no country is fully prepared, and in fact, The average score for countries across the board was just 40.2 out of 100. I think it's really important to note that while the United States is the country that comes out on top, as the president mentioned in his remarks at the press conference, we really have a score that's in the low 80s out of 100. That's a B. That's not good enough. And we saw gaps in areas like access to health care and public confidence in government. And I think those are gaps that we can really see hurting us now as we look at how the country is preparing for the outbreak.
So according to your ratings, it looks like the United States does better than the rest of the world pretty much. It's just not good enough. Where do we fall short? What specifically should we have done or should we do now?
Yeah, so one of the areas where the United States falls short is in our access to health care. And even though in some of those indicators we do better than other countries, we're still in the 70s for many of them, meaning how prepared is our health system to handle the increased load that we might see from a large explosion of cases in coronavirus. We also don't have a right to access health care, and there are many Americans that don't have access to health care. That's a challenge. And then we fell short on public confidence in government. So how confident are the American people in our ability to handle something like this? So those are just a few areas where we need to do some work. But even more importantly, around the world, there are so many countries that are unprepared for this. And we really need to be focused not only on leading here at home, but also leading the global response.
So let's break those two things down, here at home and then leading the global response. Here at home, I think most people would say we're playing from behind a little bit, and maybe that's not surprising. We didn't necessarily anticipate this was going to happen, although perhaps you did. But can we catch up, and what do we need to do to catch up?
I think we can catch up. I think we are behind. One of the main issues that obviously lots of experts are speaking about this week is the need to get testing out for everyone who has symptoms, and to be able to do that in a way where people who are tested are not infecting others. So there's some interesting new approaches being employed in places like Seattle, where we might see at-home test kits that are available for people to actually drop off, get tested, and actually not even come into a clinic. And I think those approaches need to be really kick-started and fast-forwarded now. We also really need to see very clear guidance, fact-based, science-based communication coming from the federal government and its public health officials. Decision makers in the states and locals, the governors and the mayors, really need decision-making guidance on when to cancel mass gatherings. And I think now is really the time to be canceling mass gatherings, which, of course, as you were just speaking about, has serious economic impacts that will definitely have to be addressed in tandem. So those are just some of the things that need to be urgently done and done now. I don't think anybody's going to look at the situation in April or May and wish that we had done less.
Questions like quarantines and canceling mass gatherings, should that be left up with the local public health officials to make the decision individually, case by case?
I think it's definitely true that each local authority and state government need to be making those decisions, but there isn't really a good rubric right now. My understanding from discussions that some of my expert friends have had with state and local authorities, there isn't really a great rubric for making those decisions. And so I do think there needs to be additional guidance that's aimed at the decision maker level for them to be making those decisions that, you're quite right, are theirs to make. I do think that now is the time to be limiting attendance at mass gatherings. We know that that's a way, even historically, looking back at the 1918 influenza outbreak, countries that canceled mass gatherings and parades did better, and we need to be prepared for that.
And finally, let's turn to the globe that you referred to before. How can we assert, I think what you called was leadership globally on this? We certainly have learned from this coronavirus that these bugs are not limited by borders.
Absolutely. So in an interconnected world like the one we live in, biological threats are increasing, and we may not see this exact type of outbreak on a regular basis, but we knew that a pandemic was coming, and we know that outbreaks that we don't expect, like the Ebola outbreak in West Africa in 2014, they're going to keep happening. And so as we look at the lack of preparedness around the world, now is really the time for our decision makers, for the G7, for the G20, to be thinking about filling the gaps that have been identified around the world. A lot of great work happened after Ebola to identify many of those gaps, and our index outlines many of them. But what's missing are incentives for decision makers, for heads of state, to actually put preparedness at the top of the agenda. I think, unfortunately, the coronavirus has done just that. It took this to do just that, but now we really have to follow through.
Okay, Doctor, really appreciate your time today. It was very informative. It's Dr. Beth Cameron. She's Vice President of the Nuclear Threat Initiative's Global Biological Policy and Programs. Still ahead, we talk with the former head of public health for the state of Louisiana about preparations for the coronavirus in her state. Plus, we're watching the markets. U.S. stocks have turned negative now after we thought they were coming back. You can see now they are down in negative territory. We'll keep watching those and bring them to you as they develop. And this is Bloomberg. This is Balance of Power. I'm David Westin. Dr. Rebecca Gee served as the Louisiana Secretary of Health until earlier this year, where she was responsible for the state's public health system. She is now CEO of LSU Health, and she comes to us today from New Orleans, although I don't see that the way she would like me to, I suspect. Thank you so much, Doctor, for being with us. Good to have you. Before we go to the broader questions of public health, give us a sense in Louisiana of where you stand with coronavirus. Do you have any cases that you're aware of? Have you had to deal with it yet?
Yes, so good morning. So in Louisiana, we have one case of the coronavirus that is being sent for confirmation to the CDC. This is a patient who was admitted to the VA Medical Center on Friday and initially was suspected to have pneumonia. Usually coronavirus causes symptoms that are lung-related, lung illnesses like pneumonia, was later found to have the coronavirus. And so right now, there are precautions that are being implemented for the individuals who cared for that person, as well as the contacts that they have. Right now, we don't have confirmation. We're waiting from the governor's office later today to talk about whether this was a case that was caused by travel or was this community spread. Community spread is when the virus is spread by contact person to person in local communities, not because someone went to Italy or South Korea or China or Iran, one of the epicenters of the epidemic.
And do you have protocols in place for health workers to screen at a very early stage? Because I've heard some stories where people deal with a patient for some time before they figure out it's coronavirus and then they are exposed. Is there a way of early on screening out and say we have to take special caution with this patient because they may have coronavirus?
So I think it's really important to follow the guidance of public health professionals on testing. The CDC has an up-to-date website that talks about who should be tested. There have been communications by Vice President Pence as well as President Trump to say, anyone who gets tested, who wants to get tested can. We have plenty of kits. Those have been inaccurate communications. And it's really important that the professionals who understand what is the update on how many kits are available, who should be tested, are the ones that are giving these messages out. And in terms of who's being tested, CDC guidance is clear on who should be tested, those who have encountered an individual patient with these symptoms. And the period between exposure and symptoms can sometimes be as high as 14 days. So it's important that people can stay home if they've had exposure, and that's within 3 to 6 feet of someone who's had this. It's airborne. It can be through coughing or sneezing and so on. People who have been close to contact need to stay away from conditions where they're in contact with lots of people in large gatherings and so on. And that guidance is updated daily on the CDC website.
One of the things we've seen a lot of reporting on is the test kit situation. Do we have any sense now of how many, I think they're called test kits, are out there available and how fast we're ramping up? Because my impression is we don't have enough facilities right now to test the people you just described.
Yeah, and one of the problems, and it's unclear why this occurred, instead of taking the WHO or World Health Organization approved test and just duplicating that and spreading them as appropriate, similar to what happened in South Korea, the CDC made a decision to develop their own kit. When they developed their own kit, the reagent or the substance that was used to confirm the results was not working, and the kits had to be, discarded. And so now the CDC had to start over, and that caused delays. In the meantime, public health entities like the Louisiana Office of Public Health, which since February 26 has been able to do these testings themselves and within 24 hours can get the results out, are doing these tests, as well as folks like Quest Diagnostics and LabCorp. In Louisiana, we have access to LabCorp that has a 3 to 4 day turnaround. So the test kits are increasing. In Louisiana, we have about 2,000 test kits. LabCorp has not yet said how many test kits, but we think around that we should have the capacity for about 500,000 people in this country. But again, we need to rely on the reports from the CDC, local public health agencies, and LabCorp to tell us that. That should not be something that political individuals should be saying. So again, right now, it's certainly in Louisiana, for the one person who's had this virus, we have plenty of capacity and we have a 1 day turnaround on testing. The question is, if and when community spread develops, will we have enough testing? And that's hopeful. Certainly the big concern here, when I was health secretary in 2017, we lost 80,000 Americans to flu. And here in Louisiana, we lost 1,200 people. And there was not panic. There's apathy to the flu, likely because we're used to it. There's a vaccine for it. So if this kind of thing ramps up to be similar to the 2017 flu season, we'll see a lot more spread. My hope is that because of the information that's being shared with the public, people are very keen on washing their hands. They're much more educated about it. We may actually see a decrease in our flu season and transmission.
So sorry I have to interrupt you because President Trump's speaking right now, but that's Dr. Dr. Rebecca Gee from Louisiana. We're going to go now to listen to President Trump.
That normally I don't think they'd be doing. And so I want to thank them, and I'll ask Vice President Pence to maybe give us a little update as to where we are.
I'll be very happy to. Thank you, Mr. President. President Trump made it clear from the early days of the coronavirus in the United States that this would be a whole-of-government approach. We've brought the full resources of the federal government to bear, but this president has also called together businesses and industries to make this a whole-of-America approach. Last week at this table, the president met with pharmaceutical leaders. We met with nursing home leaders, the leaders of commercial labs, airline industries. We're bringing all of the businesses of the country to bear to protect the health of the American people. But today, Mr. President, you directed us to bring together insurance companies, health insurance companies that cover through private insurance and through their support of Medicare and Medicaid, almost 240 million Americans. And I'm pleased to report, as you requested, Mr. President, that all the insurance companies here, either today or before today, have agreed to waive all co-pays on coronavirus testing and extend coverage for coronavirus treatment in all of their benefit plans. And at your direction, Medicare and Medicaid last week already made it clear to Medicare and Medicaid beneficiaries that coronavirus testing and treatment would be covered. These private insurance carriers have extended that as well. They've also agreed to cover telemedicine so that anyone, particularly among a vulnerable senior population, would not feel it necessary to go to a hospital or go to their doctor. They'll know that telemedicine is covered. These CEOs have also agreed to no surprise billing. We want people to get tested. Over 1 million tests are out thanks to the diligent work of CDC and HHS. More than 4 million will go out this week. You've worked with commercial labs to expand testing, and that'll continue to increase by the day. But we want the American people to know that they are covered through private insurance. They are covered through Medicare, Medicaid, and there'll be no surprise billing. And finally, Mr. President, as you directed us yesterday, we produced helpful information for every American family, how they can keep their home, their school, their business, their establishment safer from the spread of the coronavirus. All of these major health insurance companies have agreed to convey all this information starting today to all of their customers, as well as to send the CDC's guidance for seniors with underlying health conditions to give them specific recommendations. And so, as you requested us, they've all agreed to work with us to communicate information directly to the American people. Because as you've said, Mr. President, while the risk to the average American of contracting the coronavirus remains low, we want a full partnership with industry and give the American people all the information they need to avoid contracting or spreading the coronavirus. And particularly, these companies are going to help us get information to seniors with underlying health conditions who really represent the most vulnerable population to serious outcomes. And I know I speak on behalf of the President when I say how grateful we are for the collaborative spirit, the generosity, and the partnership represented by the great companies at this table.
That's true, very true. And we are working very closely with the cruise line industry, and very, very closely. They're taking very strong steps in terms of people going on and going off, but they're spending a lot of money, and they are working very hard, and we're going to be helping that industry. Likewise with the airline industry, they're taking very, very strong steps for people coming into our country, even getting off the planes. So we are working very closely with them. We're helping them. They're two great industries, and we'll be helping them through this patch. And so far, I think it's been going very well. You know all about the big ship that came in yesterday, and that's going along incredibly well, working with the state of California successfully, very successfully, also with Canada and with UK. So the UK is taking their people, their citizens back, and Canada is about 600 people. They're coming back. They're being met and brought to planes and being brought very, very, in a very, very dignified fashion back into Canada. So we appreciate all of the help we've had in that, and that's working out very well. With that, I might just ask a couple of folks if you'd like to make a statement on behalf of the industry. Perhaps would you like to make a statement on behalf of the industry?
Sure. This is Gail Boudreau, and one of the things that I think is most important is from day one, as an industry and as a company at Anthem, we have been very focused on ensuring access to care, and that cost is not an issue for people to have the testing appropriately done. So we're pleased that we're able to continue to expand this access. And as the President said, I think it's really important for all of our customers, our members, and the American people to have this. So we are very supportive of the efforts underway.
Great job you're doing. Thank you very much. Anybody else? Would anybody else like to make a statement? Even the ones over here, you can turn your head. Sure. Look at those cameras.
Sure. So I'll say on behalf of the industry, yes, we represent the great companies around the table here, but then those that operate at a local level, that we all have the same commitment to making sure that cost is not a barrier to people getting tested and treated. We want to make sure that we're focused on prevention, testing, and treatment, and getting that information out as quickly as we can to make sure people know how to limit the spread of the disease.
Very good. Thank you very much.
And Mr. President, on behalf of the 36 independent Blue Cross Blue Shield plans that insure 1 in 3 Americans, we're pleased to make sure that people have access to the test, to the coverage that they need. I also want you to know that the commitments we've made also apply to the Federal Employees Program, where we insure over 5 million employees.
That's great. Thank you. Thank you all.
Maybe.
Please.
I would just like to say, as a large servicer of Medicare, that we are very oriented to the aging population, and most importantly, how do we make it as easy as possible for them to receive their test? And being able to do it in the home is a very important part of that. And so when we think about telemedicine in the home, it reduces great barriers to allow them to have the testing.
And a lot of people now are taking advantage of that, really strong advantage. Who else would you suggest?
Dave Whitman.
Dave, please.
Mr. President, thank you for having us first and foremost. And I guess just to extend the conversation here, we're working very hard to protect the health workforce, which we think is essential to ensure that Americans have access to the proper care. Getting the health workforce back to work, so quickly tested and back serving patients is a high priority for us as an organization serving somewhere around 18 million patients across America.
Right. Thank you. And Governor Pete Ricketts, Nebraska, everybody. Nice to see you, by the way.
Mr. President, I just appreciate your leadership and the Vice President's leadership to work with the governors to be able to make sure we're keeping people healthy in our states. It's been a fantastic cooperation at all levels of government. We really appreciate also all the cooperation of all these executives around the table to make sure that the people in my state and all the states across the country will be able to get the test and not worry about having to pay for it.
Right. Great thing. Thank you all very much. Thank you. Thank you very much, everybody.
You are? How soon do you think you'll have a package to present to Americans? Go! Come on, Mr. President, your former Homeland Yeah, he's fine. We're about 10 days away from the hospitals getting filled up. I said, is he still going to Capitol Hill? He said yes.
We have been listening to and watching President Trump and Vice President Pence meeting with health insurers, people who are very much involved in the coronavirus epidemic right now, at the White House. And what we heard from President Trump is that the situation with the ship being offboarded out in California is going very, very well. We heard from Vice President Pence that the insurers have agreed to waive co-pays on the testing, also telemedicine charges, and by the way, also that they would agree to no surprise billing, something that had been pending as a bill up in Congress. So at least with respect to the coronavirus, they've decided that they are going to waive those charges, and now they're going to go on and have their meetings with the health insurers. This is part of a series of different industries coming in to meet with the president and the vice president about what to be done about the coronavirus. And now we want to turn to a colleague, a congressman actually from the state of Michigan. He is Democratic Representative Dan Kildee, and is a native of Flint, Michigan, who has served his home district in Congress for 4 terms. Congressman Kildee comes to us today from Capitol Hill. So thank you, and thank you for your patience, Congressman, because we had to listen to the president there. So let's start with the coronavirus, because it's on so much of our mind right now. And the people of Flint is no exception by any stretch of the imagination. What do you think that we should be doing in terms of fiscal support? We're going to have a plan under the president, we're told today. What do you support in terms of supporting the people of Michigan to deal with this coronavirus?
Well, I think first and foremost, as was being addressed by the president, the vice president, and others, we need to make sure that there's universal access to testing. It's great that the insurers will waive any fees or costs associated with that. We need to make sure that people who do not have coverage also have access to free testing. The best way to contain the virus is to know where it is so that people can act accordingly to protect themselves. That's a big step. I think also some incentives that would allow for people who are sick to stay home. Obviously, if somebody has sick days, paid sick days, it's easier to make that decision. For those who are in the so-called gig economy or maybe working in a job where they don't have paid sick days, we can't just assume that they're going to take that time. And I think there is a way for the federal government to step in during this period of time. We're working on some ideas around that to make sure that if you're sick, you can stay home and you're not in a position where you're afraid you're not going to be able to take care of your family as a result.
Congressman, you had to deal with a public health crisis in Flint, Michigan itself when we had that lead in the water, and you were instrumental in getting money from Congress from both sides of the aisle to try to help Flint get out of that. What lessons did you take away about things that we should do or should avoid?
I think the most important lesson from Flint is that the crisis isn't over when the crisis is over, that there's an economic impact that Flint right now is still experiencing. We need to make sure we scale the immediate response to the size of the problem, and that's of course what we're focused on right now. But what we know in Flint is that the crisis goes on long after the cameras are gone, long after the water is bad. There's an economic impact that we need to be addressing. And when we see now what's happening, of course, around the country, the economic impact is serious. So we need to begin to turn some of our attention to what we should do to make sure that we minimize the negative economic impact. And this is one of those areas where we need to work. You know, we say this all the time, but we have to. We've got to work across the aisle. We've got to work between the Congress and the White House to get this right.
Yeah, as you say, people say it all the time. This time it really counts, and you would know from your own personal experience. Thank you so much. Again, I'm sorry that we interrupted you there for President Trump, but we needed to do that. That is Congressman Dan Kildee from the state of Michigan and from the city of Flint, my hometown. Continue on radio. In our second hour, we're going to talk to Maddie Duppler of the National Taxpayers Union on the possibility of a payroll tax cut. This is Bloomberg.